Nagpapapansin lang yung mga yan. They are manipulative. Delikado yung mga yan, bayolente pa. Ano bang pinagkaiba niyan sa mga bipolar? These are just some of the misconceptions we hear from left to right towards borderline personality disorder, when in reality, BPD is far from these misconceptions that continue to perpetuate for it not to be treated accordingly. They do not only contribute to stigma, but also hinder effective support and care for individuals with BPD. Thus, we'll break free from misinformation on borderline personality disorder and become more informed on its reality today.
Personality traits are enduring patterns of perceiving, relating to, and thinking about the environment and oneself. When this become inflexible and maladaptive, causing significant functional impairment or subjective distress, do they constitute personality disorders? There are multiple personality disorders grouped into 3 clusters based on descriptive similarities, one of which is borderline personality disorder. Under Cluster B, disorders characterized by dramatic, emotional, or erratic behaviors. Borderline personality is characterized by a pervasive pattern of instability of interpersonal relationships, self-image, and affects, as well as marked impulsivity. So when can borderline personality disorder be diagnosed?
The essential feature of borderline personality disorder is a pervasive pattern of instability of interpersonal relationships, self-image, and affects, and marked impulsivity that begins by early adulthood and is present in a variety of contexts as indicated by 5 or more of the following. Frantic efforts to avoid real or imagined abandonment. Pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. Identity disturbance, markedly and persistently unstable self-image or sense of self. Impulsivity in at least 2 areas that are potentially self-damaging. Recurrent suicidal behavior, gestures or threats, or self-mutilating behavior. Affective instability due to marked reactivity of mood. Chronic feelings of emptiness. Inappropriate, intense anger or difficulty controlling anger. And lastly, transient, stress-related paranoid ideation or severe dissociative symptoms. Now, many believe that BPD, an adult-onset disorder, is a lifelong condition that cannot be effectively treated. However, in reality, BPD is treatable through evidence-based interventions or treatments.
Psychotherapy such as cognitive behavioral therapy, dialectical behavioral therapy, and schema therapy are the treatment of choice for borderline personality disorder. While medication can be added to manage other symptoms of BPD, it isn't the first line of choice for treating this particular personality disorder. CBT is a structured approach that allows for gradual, targeted interventions that address both the cognitive and emotional underpinnings of BPD. DBT operates on the principles of balancing acceptance and change, making it particularly effective for addressing the emotional dysregulation and impulsive behaviors that characterize BPD. Lastly, schema therapy focuses on treating the early maladaptive schemas and the schema modes that produce and sustain unhelpful patterns of behavior and emotions in patients with BPD. These are only a few of the psychotherapies that are proven to be more effective in addressing core BPD symptoms. Thus, with the appropriate treatment, individuals with BPD can learn to manage their emotions, improve their relationships, and lead fulfilling lives.
You see, knowing a particular mental disorder is necessary not only to be aware of how it would impact our surroundings, but also to be correctly diagnosed and treated. In this particular case, the borderline personality disorder or BPD. as psychology students and future professionals in this field, there is a particular need for us to be the first line of accurate and reliable information rather than the other way around.